and welcome to How to Gastro. In today's video, we're going to be talking about a very fascinating and interesting disease, and that is monkeypox. So let's get started. So what is monkeypox? Human monkeypox is a zoonotic disease which is caused by the monkeypox virus. Monkeypox occurs primarily in the rainforest countries of Central and West Africa, and was first recognized as a human disease in 1970. Health researchers first identified the viral infection in laboratory monkeys, African tree squirrels, mice, rats, and rabbits, and later found that the disease could also be spread to humans. So from this definition of monkeypox, we get that it's a zoonotic disease, and the term zoonotic basically means that the disease affects animals as well as humans. Similarly to what's been said very recently of diseases such as the coronavirus. So these diseases are called zoonotic because they affect humans and animals. And in cases of the coronavirus, the majority of the suggestions indicate that it actually came from the pangolin, which is an ant-eating animal. But the coronavirus aside, monkeypox is actually caused by the specific monkeypox virus, and this is actually what the viral structure looks like. So the disease originated in countries of Central and West Africa and then was able to be spread to the rest of the world. So the most common animals involved in the disease are the African tree squirrels, monkeys, hence the name monkeypox, mice, rats, and rabbits. So in this little image down below, it actually shows us an example of this rat, which is called the giant Gambian rat, which is indigenous to Gambia, which is actually a country which is found in West Africa. So the disease was actually carried from Gambia by this Gambian rat into the US because these rats were imported from Africa as exotic pets. So when they got to America, the disease actually spread to the prairie dogs, which are actually herbivorous burrowing rodents. So it's actually a type of squirrel. It's not actually a dog, it's just a type of squirrel. And these prairie dogs were then captured in Texas for the use as pets. So many of these people housed these little squirrels. And then in this way, the humans actually contracted the disease when they got scratched or bitten by the infected prairie dogs. And so this is how the disease progressed, spreading across multiple countries around the world. So now that we know what the basics of monkeypox is, let's take a closer look at how one can contract the disease. So the transmission of the monkeypox virus occurs when a person comes into contact with the virus from an animal, human, or materials contaminated with the virus. So the virus enters the body through broken skin, and even if it's not visible, so the wound doesn't have to be a deep wound, but any sort of broken skin in which a bite or a scratch happened, this could be the entry site of the virus. So the virus can also infect a human through the respiratory tract or through the mucous membranes, such as the eyes, nose, or the mouth. Animal to human transmission may also occur by a bite or a scratch, bushmeat preparation, direct contact with bodily fluids or lesion material, or indirect contact with lesion material, such as through contaminated bedding. And human to human transmission is also thought to occur primarily through large respiratory droplets. So the majority of individuals infected with the disease actually get it through a bite or a scratch from the animals which are infected with the virus. People may also get it through bushmeat hunting, and in this way the virus can be transmitted to the humans. So once in here, in the human form, we have secondary transmission, and that means human to human transmission. So in addition to the virus being transmitted to humans from these animals, they can also be transmitted from human to human. So when a person who's infected with monkeypox sneezes or coughs, multiple viral particles are released into the air, and they can be breathed in or inhaled by someone who's standing close by. And in this way, this person may also be infected with the monkeypox virus. So as we can see, the ways in which a person can become infected are actually quite vast. Some signs and symptoms of monkeypox. So the illness actually begins with a fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. And within 1 to 3 days after the appearance of the fever, the patient will develop a rash, and this often begins on the face and then spreads to other parts of the body. And the lesions progress through the following stages before falling off. So the first stage of the rash is called a macule, and these are usually flat, red, and multiple, which are found all over the skin. From the macule stage, it will develop into a papule, and in this stage, these lesions will actually become raised. From here, we will have vesicles, and this is actually a fluid-filled region. So now we develop something that looks sort of like this. And then we develop pustules, which means the fluid actually becomes filled with pus, which is the leukocytic fluid. And from the pustule, we will have several stages of the pustule, and then eventually the pustule will actually break open and ooze liquid. And finally, the rash will scab and dry over. And the illness typically lasts about 2 to 4 weeks, and in Africa, monkeypox has been shown to cause death in as many as 1 to 10 persons who contract the disease. So I just want to show you guys the classic look of what the rash could actually look like. So let's go back to the first slide. So as we can see, this is actually the typical aspect in the pustular stage of the disease. And from this stage, these pustules will actually break open, crust over, scab, and then dry off and fall. And this is actually the typical aspect of the rash that the patient will present with. So moving on, let's explore the diagnosis. So the diagnosis of monkeypox is done by culture, and this means that the scabs are swabbed, and we can also aspirate lesion fluid, and these are preferable over the blood samples. And this is due to the limited duration of viremia. So even though the patient might have the monkeypox virus, the presence of the virus in the blood may not always be detected because there's a limited duration of that viremia period. So therefore, to better confirm the diagnosis, it makes more sense to take swabs of the scabs or even aspirate fluid from these lesions and actually send them for laboratory testing so we can confirm the diagnosis accurately. So the virus does not remain very long in the blood, and hence blood testing may not always detect the disease. So that's why it's much better to use culturing. And finally, let's talk about the treatment of monkeypox. So there is no specific treatment available for monkeypox. So therefore, the treatment administered is symptomatic and supportive, including the prevention and the treatment of secondary bacterial infections. But the smallpox vaccine has been reported to reduce the risk of monkeypox among previously vaccinated persons in Africa. And the therapeutic use of the antiviral drug cidofovir is also currently being assessed. So the treatment, because it's a viral infection, is strictly supportive. So we make sure the patient is hydrated, their vitals are stable, they are well rested, and we may also need to administer them some antibiotics in case a secondary bacterial infection results, but not to treat the viral aspect. This is just in case the secondary bacterial infection has an onset. So something very interesting also about this disease is that persons in Africa who were previously vaccinated for the smallpox virus had also shown reported reduced risk of developing monkeypox. And this is because the smallpox virus and monkeypox virus are very similar in shape and aspect. So that's why the smallpox vaccine has shown somewhat of a beneficial result in also preventing monkeypox. So I did do a video on smallpox. It's a very interesting video, and smallpox was actually the first disease worldwide to be eradicated by vaccination. And the symptoms of smallpox, which is the rash, is very similar to the rash which is seen in monkeypox. So if you guys want to give that video a watch, I'll put a link in the description for it, and I'll also put a link up in the suggestion box above. And that brings us to the end of this video on monkeypox. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure to turn on your bell notification so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care, and bye for now.